Hi, everyone. My name is Bautista. I'm here with Dr. Youngman. Thank you so much, Dr. Youngman, for joining us. We're going to be talking about mental health during COVID-19, and I think this is a topic that hasn't really been brought up and spoken about a lot, especially in the media. And we're using the tools that we have at hand to have that conversation. So, welcome, and thank you so much for joining us.
Thank you. Thank you for having me.
Yeah, so let's begin with us talking about how is the current pandemic affecting people's mental health.
Mm. Well, I think this is really a multi-layered question. It is in fact affecting people of in all different kinds of fields, and especially our essential workers, our healthcare workers. Think about how they have to work longer shifts these days, and they have to stay away from their family. A lot of them are away from their family for an extended period of time, and they're worried about how they might get sick. They're witnessing their coworkers getting sick, or their patients die, or even their coworkers passing away. So imagine the impact that it has on their mental health. And also, those people with the history of mental health already, that could certainly exacerbate their existing symptoms. For example, think of a patient with OCD symptoms already, frequently washing hands, right? They might just be prompted into wanting to do this more. And and people without mental health history, they could also be at risk of developing this symptoms during this adjustment period. And also people who, yeah.
I was going to say, could we go back to what is mental health and how does it connect with emotions? Because I feel like we haven't really, we haven't really gotten into the weeds of what that means. Sometimes it's something we don't really, we think about the physical and we don't think about the mental. So can we cover those basic principles as well?
What is mental health? That's a really good question. I feel like I could talk about this for hours and hours. I actually prefer to call it our well-being. Mental health, that has an implication of mental illness. And when we think about mental illness, we think of there's a lot of stigmas tied to it, right? An illness and a defect. It's implying that you are sick, or sometimes in our field. There's this word, crazy, which I don't particularly feel crazy about. you know, um, so that kind of holds people back from seeking treatment. So mental health, a sense of well-being is really feeling able to function well at your full capacity, and even at times of challenge, which it is normal to experience fear, anxiety, and depression, but still being able to reach out, connect with people well, and function well, performing your daily tasks. And that is what I call mental health in the short term.
Yeah. And how does, so for example, people not being able to go out in this times because it's a health necessity too, right? Being able to keep a social distance. In your practice, and again, this is not what did you mention? It's not a therapy that you're giving out right now. It's more of
Right.
some background information, insights on your expertise. But what have you seen in your practice in regards to how it has affected people's emotional health, and how could that have a connection with the physical health as well?
That's a very good question, Ron. So I work mostly with couples, marriage, and families. What I've commonly seen these days is increased family conflicts. Think of adult children who were away from the family and now they have to move back and from college, moving back, living with the parents and multiple siblings living together. That could create conflicts because they already at the stage of where they're used to their autonomy and personal space, and everybody just crammed up together. And there's this concept of returning home. Usually, these unresolved family dynamics could spark some conflicts there as well. Couples, children who are missing school and their friends That's a real thing right now. A lot of kids have complained to me how they really miss their routine daily activities where they will have that, contact with their friends, just being able to go out, and also not knowing what's going to happen when school is going to be back in session. These are all real fears and anxiety and these unknowns that are bothering them right now.
And there's, you mentioned a stigma before. There is a stigma around mental, emotional health, and getting the help that people need. Either talking to a psychologist or acknowledging that the current situation is affecting our mental health. What would you say to people so they can break away from those stigmas?
Mm. Well, I think that it's not something that a psychologist could say to a person to help them break away from it, but it's really the effort of the entire community,
Mm-hmm.
and it's a work that's on a very wide scope that we must accomplish. We
Mm-hmm.
need to first of all normalize what mental health illness is. What mental illness,
Normalizing
for
is
example,
important.
anxiety. It is, believe it or not, it's hardwired in our mechanism to protect
Mm-hmm.
ourselves.
Mm-hmm.
To look out for danger, right? And think of depression. It's certainly normal for people to feel down and depressed from time to time when it comes to special circumstances in life. Let's say you
Mm-hmm.
just experienced a loss, and it's only natural for us to cry, to feel sad, right, to feel angry. These are all normal. So first step is really to normalize these emotions, normalize these sometimes seen as negative emotions, or just you being weak. you
Mm-hmm.
know um, and the next thing is, like I said, educate the community about what mental health is and how it is connected to our emotions. And I'm very aware that different cultures, they might experience mental illness or the emotions very differently. Like you mentioned, physically, and also their way that they could experience it behaviorally too. For instance, some cultures, they might experience anxiety, chronic anxiety as headaches, or we might hear people say, I'm having problems, falling asleep for the past 2 months or so during lockdown. Um, that's a behavioral way of your body telling you that something's not right, and this is the time that you need to perhaps talk to someone, right? Another thing is just to really raise awareness of the practice of mental health practice. I think that everybody should seek mental health counseling
Mm-hmm.
personally. Think of, when you get ill, you take the medicine, right? But when you're not feeling ill, you can still take multivitamins to stay healthy,
I think
right?
that's
So
an
that's an
important point.
analogy.
It's a very important point that you bring up because we're always talking about how we need to have annual checkups for our physical being. Should there be
Right.
annual checkups for our mental health as well?
Absolutely. And I think that maybe quarterly checkups for our mental health too. Yeah, just to regularly meet with a mental health professional and just check in with them about, the daily events and changes that took place in your life. Changes always bring about stress,
Mm-hmm.
always. It could be good or bad. It doesn't matter. You have to adjust to the changes, and adjustment always brings about stress. So, yeah, it's very important to regularly check in with your therapist. And if you already have an existing mental health issue, then continue to meet with your therapist during this difficult time. If you think that you might be experiencing some things that you can't handle, there are signs to look out for, and it is also warning signs that you need to talk to someone professional.
And you, that's a very important point as well. Looking out for the signs, I feel like we haven't really gotten, as a society, as a community, the tools for us to really identify. Right? I mentioned the stigma earlier because I've seen, people. I understand that there's a need to stay home and have a social distance because of health reasons. And that's a reason. There's a reason why the authorities themselves say, it's okay to go out for a walk. It's okay as long as you keep your social distance and you don't stay outside for long periods of time, and you don't socialize because we're in the middle of a pandemic. But there's people that kind of give the notion that the people that need to go out for a run or a walk or a bike ride, could be weak because like, oh, why do you need your exercise? You can just exercise indoors.
Mm,
But there is that notion that no, we don't. We sometimes we need that fresh air. Sometimes we do need that activity outside. So
absolutely.
could you tell? I know that there are programs that prepares people to learn the foundation of addressing mental health. What
Mm.
would be the benefits of empowering a mom, a brother, a teacher, ordinary people like myself, with the basics on mental health?
Oh, it's extremely important to empower all these like you said, ordinary people with mental health knowledge, basic knowledge of it, because potentially you could save a life. How? You have the opportunity to identify people who are at risk, such as a child in your home who's starting to kind of I have parents telling me that they're looking at some dark videos online with their friends. So there's a sign there. Why are they looking at these things? And
Hmm.
people who have been removed from their normal social group online, they're not attending the group anymore. These are signs. People who have been, let's say, used to enjoy playing basketball, and even though they can still go out there and play or even run, jog for a while, they're not doing that anymore. These are all signs, and I think it's important for people to know these signs and know what look out for, and reach out to them and provide them with the resources to intervene early on and prevent this from getting worse and worse, and it eventually potentially could save a life, like I said.
Great. And are there any tools, any educational tools that people can
Hmm.
take up on that they can
Hmm.
so they can learn the basics and they can be
Hmm.
empowered on these issues?
Yes, in fact, there's a lot of tools. I mean, I'll just mention a couple of them here. There's one called Mental Health First Aid.org. That's a very good tool. It's a website you can go on to and learn a lot about. Especially, it has a lot of information about how to deal with COVID situation right now, such as maintaining a regular life routine, self-care, limiting exposure to the news and social media, stuff like that. And
Hmm.
another tool is called a Cognito. It is a health simulation company, that develop these tools to help, especially with children, PK-12, higher education healthcare workers for children. That's a very interactive tool. So these are just a couple of ones that I will recommend. There's also a lot of helplines during COVID situation that are available out there. I'll be more than happy to share them with you if you can, post them and share with the community.
Yeah, perfect. Thank you so much. I appreciate your time.
Hmm.
I think this has been very insightful. Is there anything else you would like to say? Anything that you would like to cover?
Sure, sure. I just also want to mention that this is not a form of giving psychological advice to, it's more of a means to educate the public and really raise awareness of mental health,
Mhm.
especially during this difficult time. And I really encourage everyone to seek professional help if you notice anything within yourself that you feel like it's hard to deal with, or if you notice someone else who's behaving out of their norms.
Perfect. Thank you so much. I appreciate it, Dr. Youngman, and we'll be in touch maybe in the upcoming time.
Thank you. Thank you for having me. Take care.
Thank you.